Ever found yourself, using terms like co-creation or maybe co-design thinking, hang on, are these actually the same thing? It happens a lot, right? Especially with ideas that sound kind of similar but have really important differences. So today we're doing a deep dive into three specific terms that are super important in public health: co-creation, co-design, and co-production. We're going to unpack what they really mean and, crucially, how understanding them helps make initiatives actually work. And our guide for this is a really interesting article from Public Health Research and Practice. It's called Co-Creation, Co-Design, and Co-Production for Public Health, a perspective on definitions and distinctions. Okay, so we all talk about collaboration, but this article really stresses that, yeah, these ideas are related, but the differences, like who gets involved and when, are absolutely vital for public health stuff.
Exactly. And what's really key here is that getting these definitions clear helps everyone involved. People in the community, researchers, the policy folks work together much better, especially on big, complicated health issues like, say, obesity or type 2 diabetes. It's really about making sure you design and roll out things in the best possible way.
Right. So let's start with the big one, co-creation. The source calls it the broadest term. What does that actually look like in practice?
Well, co-creation really is the overarching idea. It's basically a joint approach to solving problems creatively. And the key thing is involving all sorts of different people, stakeholders, right from the very beginning.
All stages.
Yes, all stages, from figuring out what the problem even is, brainstorming solutions, right through to actually doing it and seeing if it worked. It's about creating something valuable together.
Yeah.
There's a good example in the article, actually, about these remote community stores in Australia.
Oh.
Yeah, where community members, the shopkeepers, and academics all worked together, co-created a healthier setup for the store. And it worked. Sales of unhealthy stuff went down.
Okay, that makes sense. Everyone involved from start to finish. So if co-creation is the big umbrella,
Yeah.
how does co-design fit underneath it? Is it just one part of that?
Precisely. Co-design is like a specific tool within that larger co-creation process. It's really about active teamwork between stakeholders, but focused specifically on designing the solutions.
Yeah.
Usually the problem's already been sort of identified beforehand.
So it's more focused on the how.
Exactly.
Yeah.
It really centers on using insights from the people who use the service, the consumers, to shape new plans and priorities. Think about that supermarket example in the article. They ran co-design workshops, right, with customers, staff, academics, to figure out creative ways to make the whole store healthier. And the result was that customers actually learned more about healthier food choices.
Okay, so co-creation is the whole process. Co-design is zeroing in on shaping the solution itself. That leaves co-production. Where does that slot in?
Co-production comes in later. It's about involving stakeholders in the part of the implementation. So you've already agreed on the problem, you've already designed the solution. Now it's about making it happen, often using the resources you already have efficiently.
Ah, so it's post-design.
Yes, definitely post-design. It's about the delivery stage. The article mentions young people with diabetes in East London.
Right.
Their input was vital for actually changing and optimizing the existing NHS services. They became key players in delivering those better services.
Okay, that distinction is becoming much clearer now. So if you had to boil it down, how do they relate based on that extent and timing idea?
Well, the source lays it out pretty clearly. Co-creation is the big, encompassing approach covering everything. Co-design. That's mainly in the early phases, finding the problem, analyzing it, defining it, designing the solution. And co-production kicks in during the making it real and evaluation stages. They definitely share ideals like, sharing power and learning from each other. But when they happen and how much people are involved at each stage is really different.
That when really seems like the critical factor. So, okay, beyond just making innovation better, why should you, listening right now, really care about splitting these hairs? What happens if we get it wrong?
That's a great question. Because getting it wrong isn't just academic. It can actually derail projects completely.
Yeah.
Look, imagine you invite a community group in, telling them it's co-creation, that they'll help define the actual problem.
Yeah.
But then it turns out they're really only there to co-produce a solution someone else already decided on.
Ouch. Yeah, that wouldn't go down well.
Not at all. It destroys trust, it wastes everyone's time and money, and you often end up with something that doesn't actually fit the community's real needs. Getting these terms right helps ensure that what you're doing is actually relevant, practical, fits the context, and ultimately leads to better results, especially when you're talking about fairness and health equity.
Right. So this deep dive really shows that knowing the maybe subtle but crucial differences between co-creation, co-design, and co-production isn't just jargon. It's actually fundamental if you want collaboration to be genuinely effective and impactful. And that makes you think, doesn't it?
Right.
How could applying clear definitions for how people work together, that kind of clarity, maybe improve things in other parts of your own life or work, even outside of public health?